Have you been diagnosed with biceps tendonitis or a partial tear of the bicep tendon? Is this impacting your ability to lift the way that you would like to, or feel like it's contributing to your ongoing shoulder pain? Well, in this video, we're going to dive into why tendonitis occurs in the bicep tendon, or how that can progress at times into partial tears, and what this means in terms of your recovery and your ability to get back into your favorite lifts. So if we zoom in on the front of the right shoulder, we can see this highlighted muscle here is one of the two bicep muscles, and the white attachment in through here to the top of the shoulder blade is the bicep tendon from the long head of the bicep highlighted down in through here, which of course comes down and attaches below the elbow. Now, as we know, some of the primary functions of the bicep are to be able to flex that elbow on that side, which you can see when we do flex, where that muscle contracts and it pulls on this white tendon in through here, which then pulls on the attachment site just above the shoulder blade here. Here. And normally when we have good balance around the shoulder and we have sufficient strength and support on the back of the shoulder, it helps to offload a lot of pressure from this tendon in through here and helps to really support the motion. Or when we select the appropriate amount of weight and the appropriate numbers of sets, reps, we're able to recover in between sessions and we don't end up flaring up or aggravating this tendon. Going here. Now, when we do start to potentially overdo things in a given day or over a given week by doing too much volume overall or not having enough recovery time, we can start to create inflammation around the tendon, which is also known as here, biceps tendonitis. So we can see in this video, the red shows the inflammation, irritation around the bicep tendon. So if we zoom in on the front of the shoulder here, again, this white structure is the tendon from the long head of the bicep. Through repetitive stress and not enough support from the other muscles around that area, this tendon can become inflamed initially. If we do take a break from some of the activities or exercises that are irritating it, we can allow that inflammation to calm down, and then things can start to settle back down from a pain perspective. If we continue to push through some of this inflammation, irritation, that tendonitis or inflammation can then end up progressing into a tear, which is why it's always critical to listen to your body. Make sure that you're differentiating in between soreness associated with muscle fatigue and a harder workout versus having pain. Because once we do tear that bicep, then we're looking at a surgical repair in order to bring that tendon back up and reattach it, or in many cases, they'll reattach the tendon down a little bit lower onto the bone in through here. So what can you do if you're currently dealing with pain along the front of the shoulder? It's irritated by exercises like bicep curls, tricep dips with your arms behind you, overhead pressing with pain through the middle part of the motion. Is you want to identify the current exercises that are aggravating things. You want to reduce how frequently you're doing those exercises or the amount of weight that you're doing. Allow that tendon and that inflammation to calm back down. If it's extremely painful to where it's preventing you from sleeping normally, you could intermittently use anti-inflammatories like Aleve or ibuprofen, as long as you're able to do that with your medical history to calm things down, and then gradually start to ramp things back up. It will also be critical to look at the balance of the muscles around the shoulder and ensure that you are using adequate support from the muscles in the back of the shoulder blade, upper back, as well as even the core muscles to help to take pressure off of that spot that's getting inflamed.